Hi guys. Okay, so what we want to do is continue with some of the autonomic nervous system and the topics. So sympathetic, we said we went through all of these, the alpha 1, alpha 2, beta 1, beta 2, beta 3, ERET, E, and the receptors associated with the sympathetic nervous system. Here's what it looks like if you guys wanted to look at a diagram. So sympathetics actually begin at the level of T1 and go through L2. So this stands for thoracic vertebrae 1 and it ends at about lumbar vertebrae 2. Um, Most importantly, you want to understand not so much the origin, but the function for sympathetics. It's the gas and the brake or the fight and flight for most of the body except for the GI tract. Anytime you think GI tract, digestion, the primary controller is going to be your parasympathetic division. But here we go. Let's do sympathetics. What would it do to the eye? Well, if you're scared shitless, I'm going to just use these words. What do you want to do? Do you want your eyes to be small so you can't see them? Or do you want your pupils to be dilated? You want them to be dilated so they let the light in. So it causes the eyes to dilate so that you can allow light to move in so you can see the object that's chasing you. Um, Salivary glands, we can skip. Let's focus on the heart. So sympathetics are the gas for the heart, right? Sympathetics are also the gas for the lungs. So it would increase the heart rate. It would open up the lungs. And what's the whole point of that? So that I can see what's chasing me. I have enough blood circulating to the body so that I can run with the legs, right? And supply enough oxygen to the legs so that I can get out of there. And then I need to be able to breathe and take in the oxygen so I can transport it through the vascular system to the legs that are running. Digestive tract um, is non-essential when you're running away from the thing that's chasing you. So this is not going to be as active when you have sympathetics. The whole reason behind that is you want to make sure that you're shuttling all the energy you have to the heart, to the lungs, to the working muscles, and you don't want to be spending too much time in the GI tract. So a lot of these structures here are associated with the parasympathetic, and when sympathetic is stimulated, these will decrease in motility, it'll decrease in secretion, it'll decrease in urinary output because you don't want to be peeing while you're running. And then adrenal medulla, we said earlier there were two parts, right, to your little Dorito chip triangle shaped thing. The middle, the middle was called the medulla, and that released epinephrine and norepinephrine. Epinephrine about 80%, norepinephrine about 20%. And then the cover itself was the cortex, which is associated with the endocrine system, released aldosterone, cortisol, and then also testosterone. Let's go to this parasympathetic nervous system. If you need to memorize this, just remember there's two different parts to it. It's called the cranial sacral because of the anatomical distribution of the nerves that come from it. Cranial nerves 3, 7, 9, and 10, as well as pelvic nerves S2 to S4, which keep the P and the penis and the the other thing for the female, the P, off the floor. And we'll play around with that. So here are some concepts to remember. Parasympathetic is for rest and digest. Sympathetic is for fight and flight. Let's play around with how these two would affect the penis. So let's say the penis, you point and shoot with it, right? So if I point, it's called erection. If I shoot, pew, pew, that's called ejaculation. Can anybody figure out, based on our little mnemonic, point and shoot, pew, pew, which one is associated with erection? Parasympathetic or sympathetic? Well, point, right, guys, is parasympathetic. I need to make sure that the male is not stressed out because parasympathetic, your rest and digest during relaxation, will contribute to whether or not the male will have an erection. If you have injury in S2 to S4, you can't keep the penis off the floor. It'll cause erectile dysfunction, right? So if you get into a car accident, why is it that you test for S2 to S4 reflexes like doing a digital rectal check? Well, you want to make sure that there's no pelvic crushing, right, or injury to the nerves. In that case, you would need to do some kind of emergency protocol to ensure that there's that other things within the pelvic region are not injured as well. But here we go again. Point, and then what system is associated with shooting? Pew, pew, ejaculation. That one was shoot. That's the sympathetic nervous system. So, fun tidbit for you to remember, point and shoot. Parasympathetic for erection and sympathetic for ejaculation. Continuing on, here's some things. So if I'm looking at the eye, parasympathetic does the opposite of sympathetic. It would be associated with pupillary constriction of the eye. With the heart, what would it do to the heart? It would slow the heart rate down. What would it do to the lungs? It would cause bronchial constriction. So when we're thinking about sympathetic and parasympathetic, where it affects the lungs and we're trying to open up the airways, we only went over the alpha 1, alpha 2, beta 1, beta 2, beta 3 in terms of whether or not I play around with inhibiting it or stimulating it. But can't we do the same thing for the muscarinic receptors when it comes to the lungs? Well, if I block muscarinics using a drug named ipratropium bromide, wouldn't that cause the lungs to dilate as well? So there's two things that you can do. You can either stimulate beta 2 receptors in the lungs to open up the airways, or you could give them a double effect by blocking, I should say stimulate beta 2 receptors in the lungs to relax and dilate the lungs by giving them albuterol. And I can also block muscarinic receptors in the lungs using ipratropium bromide to cause the same effect. So it's dual action, two different ways to effect the same goal of opening up the airways. And here we go, some more information. So GI tract, definitely going to be triggered by parasympathetic nervous system. So more digestion, more secretion will occur, more motility when you have parasympathetic in effect. And here are some receptors. So this you guys can review. Alpha 1, alpha 2, beta 1, beta 2, beta 3, ERAT, ERAT, E. They didn't even put beta 2 on there. Sad. And this is pan-am. So this is SAN beam. Pan-am, SAN beam. And we can move on to this. So let's see if you guys can remember this. So alpha 1, alpha 2, beta 1, beta 2, beta 3, ERAT, ERAT, E. So what's the function of the alpha 1 receptor? It's to cause excitation and contraction or contraction of whatever it's acting on. So alpha 1 receptors found in sweat glands will increase and stimulate the production of sweat. It'll cause these muscles, which trigger the hair to stand on end. So erector pili muscles are stimulated by alpha 1 receptors, cause erection of hair follicles when you're cold. Let's go through some more. So beta 2 receptor would relax and dilate, right? Blood vessels that go to the skin, but alpha 1 receptors would cause constriction. So here's the dilemma. If I have the release of epinephrine, and let's say the epinephrine might bind to the beta receptors more than alpha, would it cause dilation or constriction at the blood vessel? Well, it depends on which one it binds to, but let's say that it binds to a beta receptor. It would cause dilation of a blood vessel to the skin, right? So you'd have hyperemia, more redness in the skin in that area. Well, let's say I gave a beta blocker in a patient that had excess amounts of epinephrine, and I block beta receptors everywhere throughout the body. So what would that do for beta receptors in blood vessels? Well, cause the dilation to be gone, right? I no longer have beta 2 receptors playing with it. But that same epinephrine could stimulate alpha 1 receptors, so it would cause vasoconstriction of the blood vessel. What would happen to blood pressure? Blood pressure might skyrocket, right? It might go up, so I might end up with somebody that has hypertensive crisis as a result. Let's look at it again. You guys can look through this. So beta 2, relax and dilate blood vessels. Alpha 1 causes constriction, but in the heart, alpha 1, alpha 2, it has slightly different effect. But in this case, look, alpha 2 causes dilation and alpha 1 causes constriction. But we know that already from the general rule. I don't know why they put the alpha 2 in here. That's not totally accurate. And we can keep going on with this. So let's move on to the next one. So all of these receptors, understand that you already know the function. You can figure it out. No matter where you put the receptor, you can figure out the function. If you memorize that alpha 1 is excitation, alpha 2 is relax and dilate, beta 1 is excitation, beta 2 is relax and dilate, and beta 3 is excitation. So if you notice, the pattern is all the odd numbers are excite or contract, and all the even numbers are relax and dilate.